Well, if you look at Medicare, Medicare is an example of what I point to, that every government program, whether here or abroad, the design of the program in healthcare reflects the way the world looked when the program was created. So the British National Health Service sort of, reflects 1940s medicine. And the Medicare program in this country reflects a 1960s picture of medicine, and that was very hospital-centric. So it is focused on hospital deductibles, and interestingly enough, the deductible was the cost of a day in the hospital. Nobody bills by days in the hospital anymore. That's no longer done. There's not like a room rate for a hotel, but that was the way it worked in 1960. They had a flat 20% copay for all the physician services. And Medicare didn't include drugs in 1960 because there weren't a lot of drugs and they weren't that expensive. There were mainly some antibiotics and things like that. So there wasn't felt to be a need to include drugs. Drugs were like vision care or hearing aids. They were something extra, which Medicare also didn't cover. So that is a very 1960s premise, the state of medical technology in the 1960s. I mean, this was before drug therapies, before heart transplants, all sorts of things. And what happened is that gets frozen in time because it's written into a government program. And so that's the problem with designing a government-run program, is these things get sort of stuck in a time warp. The better approach is to focus not on the design of the program, but focus on the people you're trying to help, and say, how do we get resources to the people we're trying to help? So if you focus on a government program design, then here you are 40 years later trying to update a clearly antiquated structure.